Hey everyone, Dr. Mark Supernaut here with Family Healing Chiropractic. Hope you're having a great and blessed day. We're just coming through a winter storm down here in Charlotte over the weekend, and so it's been kind of a fun few days. Office is actually open today, but probably shouldn't have been. It's pretty nasty out there. I wanted to speak about today just really a topic that's pretty common in chiropractic is neck pain and headaches. In fact, our very own Dr. Brandon gave a testimony earlier today to the team about how when he was 9 years old, he was having bad headaches, and they had tried everything, tried all these medicines, tried all this stuff, and finally his dad met a chiropractor, and he started getting adjusted when he was 9 years old, and it helped the headaches, the migraine headaches, and completely went away. And so he remembered that when he got older, and he ended up becoming a chiropractor because of that, because you really don't realize how bad it gets when you're in aches and pains, you have sickness and disease and problems. The fact of the matter is that it disrupts a lot more than just even the fact of having a headache. When somebody tells you they have a headache and you've never had one, you can't really relate. But when you start to realize that headache for that person is affecting their sleep, it's affecting their work, it's affecting their ability to be able to be friendly with their neighbors or with their spouse, with their kids, have patience. So today we want to really just dive in and can chiropractic help neck pain and back pain and headaches? Just some of the stats and facts out there right now. Neck pain and headaches are among the most common health complaints the United States has. Affects tens of millions of people every single year. Neck pain is leading cause of disability for worldwide. Billions of dollars are spent on medications, imaging, lost workdays, productivity, treatments, and then, of course, most care focuses on pain relief and not correcting of what's the cause of the problem. So this isn't just a health issue. It's like I said before, it's an energy issue. It's a productivity issue. It's a quality of life issue. It's just being able to have your mind together. One of my old employees that used to work with me, we had adjusted her sister, who was a roommate at the time, and she was having problems, and she's just like headaches and depression and anxiety, all this kind of stuff. And she's just like, after her first adjustment, she's like, what did you do? You adjusted she said the B word out of my sister. And it's like, it's such an amazing change and difference so quickly that her life changed with one adjustment, because when you start to take that pressure off of headaches and problems, your life starts to change, and it starts to be affected in a different possibility in a different way. So what neck pain and headaches do to people, people with chronic neck pain or headaches, they don't just hurt. They wake up tired. They have difficulty focusing and thinking clearly, becomes short-tempered, irritable. Like I just said, we've had plenty of patients like that. Avoid exercise, social activity. They rely on medications just to get throughout the day. You guys have heard this before, and you guys know this. When you're not feeling well, it affects how you interact with people. It affects your ability to be able to do what you were put down here on this planet to do, that God created you for. And so pain just changes how people show up at work. They change at home. They change relationships. And over time, people stop asking, why is this happening? And they start asking, like, how do I live with this? What can I do with this? And people get just desperate. They don't know what or how or how they can live with this thing. And they start to change how they live, and it affects their life on a day-to-day basis. Symptoms are just the signals. They're not the actual problem. Headaches and neck pain are warning lights. I said this last week when we talked about back pain. Any kind of symptom is just a warning signal. It's your body trying to adapt or coordinate through it, and it just can't do what it's supposed to do. So that the aches and pains is your body trying to tell your brain and trying to tell the overall system that something's just not right here. Something's not working the way that's supposed to. So, and one of the analogies they say is a headache is like a fire alarm. You don't just remove the battery and just say, hey, it's all solved. I mean, you guys have all had that, where you have that chirping in your ceiling and you just take the battery out because you're just like, I'm done with this thing. But it kind of defeats the purpose. If you wanted that fire alarm there to warn you and your family of actually being there in case a fire actually happens, you didn't really solve the problem. All you did was just kind of take care of the symptom for a little bit. It's the same way with headaches, same thing with neck pain, same thing with depression, anxiety, anything you have. These things are happening because your body's trying to warn you. And the common approaches are, and I tell my patients this all the time, 3 options. People that come to us from the radio show, they come through here knowing, and I ask almost every single one of them that comes through my front door, like, why are you here? And they said, because on the radio, you said that I can keep medicating it, I can keep ignoring it, or I can actually get to the root cause of why is this happening? Why is my body not functioning the way it's supposed to? And the question down here at the bottom, it says, not where does it hurt? It's the real question is, why isn't my nerve system adapting and coordinating properly to allow my body to function in the way that it needs to and supposed to? That's the question you should be asking. So why chiropractic and headaches are connected? Well, the neck protects and houses the brainstem control center for the posture and coordination and adaptation. The neck, they've done tons of research. The neck and the structure of the neck, if there's stress here, a lot of times there's stress in the prefrontal cortex of the brain, which can decrease neuroplasticity, which actually decreases serotonin, dopamine, can cause depression, anxiety, other problems along the way as well. So that brainstem, and people relate just because we are adjusting the spine, and most people relate, and even chiropractors, a lot of chiropractors perpetuate this, is that they think we're neck pain and back pain doctors. Why do they think that? They think that because we perpetuate that. Because a lot of times if you have structural issues in your nerve system, whether it's in your neck or in your low back or middle back, wherever it is, a lot of times pain will come with that. But remember, the pain is the warning signal. Because it is part of the spine, what it's trying to do is your body's trying to help you understand that there's control centers over the posture, coordination, adaptation of your nerve system, and your body's trying to warn you. And so if the communication between the brain and body is distorted, the body compensates. It has to do something with it. If you're sitting there looking at computers all day long, if you have a lot of emotional stress, physical stress, chemical stress you're exposed to on a regular basis, your body has to adapt. If it can't adapt to these stressors, something has to give. And so it's like, I use this analogy on a regular basis, is that I'm losing my voice, sorry. I use this analogy that your brain and body and the functions of it are kind of like a circuit breaker. Is that if my daughters, I have 4 daughters, if they all plug their hair dryers and curling irons in the same wall socket, it's going to short circuit and it's going to blow a circuit. Now, is that desirable for the girls? No, they hate that, right? They'd love to have their hair dryers and their curling irons, straightening irons, all that stuff work. The problem is that if that circuit doesn't break, it could cause a whole house fire. And so instead, to basically take care and protect the whole, the circuit has to break for that to happen. Now, at the area of stress where all the hair dryers and all the stuff is plugged into the wall, you've got to change that. Otherwise, it's going to keep happening. It's going to keep short circuiting, right? You can't just go flip the switch and say it's good. So really, it's very similar within the nerve system and the chiropractic, is that when your body's overloaded, it can't adapt to stress anymore. Like a short circuit, the spine will move out of a position, which we call in chiropractic subluxation. I'll talk more about that later on down the road in a different series. But that structural issue now disrupts how the brain's able to communicate through that nerve system. And so you've got to reset it. Adjustments, finding the location of the subluxation, the misalignment, adjusting it, restores it. But you also want to start to remove some of the stressors that kept causing this to happen on a regular basis, which is the key of what we do in our office. See, chiropractic focuses on restoring the nerve system communication, improving the adaptability to its stress, and allows the body to regulate and heal itself. Basically, it's not about treating the headaches. So I have probably hundreds, if not thousands of testimonies of people with headaches over the course of their life, over the course of the life of this clinic. It's been here for 21, almost 22 years. We have hundreds, if not thousands of testimonials about this. And for none of them, I didn't heal anybody's headaches. The body healed its own headaches, but it didn't heal the headaches. It healed what was actually causing the headaches to come to the surface. So what we get a chance to do as chiropractors, we help the body function better. When function improves, the body just takes care of its symptoms. It's how it works. Now, does it always take care of the symptoms? Not necessarily right away. Sometimes it takes time. Sometimes it will never take care of the symptoms, but your body function at a higher level is the key. In most cases that I see in my office, that's what is that the body will start to function better, and then the body will learn how to be able to heal itself. You'll make better decisions, better choices, and the body will start to go on the pathway that it needs to go on. I always talk about the function chart. And so when we talk about function of the nerve system within chiropractic, you would like all the way on the right-hand side there, you'd like the body functioning at 100%. And when you start to lose function, though, it goes down to 0%. So if your body's at 0% function, that means that your body is obviously dead. If your body's functioning 100%, it means it's constantly adapting. Does that mean that you're not going to die? No. We all still have limited time on this planet. Okay. But what happens is if your body is functioning 100%, your body has the best ability to adapt and coordinate. So you get the most expression of life out of what God gave you while you're here on this planet. What disrupts that though is when the spine is stressed and your body can no longer adapt to that stress, it will start to shift and go out of alignment. And you guys, I showed you guys this picture last week. There's bones of the spine, there's vertebra that surround and protect your brainstem. And when you look at the spine straight on, the spine should be perfectly straight up and down. But as you see on this illustration here, the spine should be curved through the neck. You're supposed to have a curve in the neck and then curves back the other way through the middle back, and then back down the other way in the low back. What happens is that these movable bones in here are there to protect and to allow the adaptation of our spine and nerve system. When those vertebrae go out of alignment though, that's when it starts to disrupt how the brain's able to communicate through the nerve system from your brain to your body. So as you look at this here, this is pretty simple that when we talk about function, if you lose function, if you go down to 60% function, that's typically when the symptoms finally show up. And the reality is, in the medical industrial complex that we live with in this country and this planet and then really in the whole planet now, but it used to be only the US was dealt this way because of the medical industrial complex got so big so fast here. Now they're spreading all over the world, is that symptomatic care is at the forefront of everything that they do. Is that it's about, let's find a way to hide your headaches. Let's find a way to hide the symptoms. What you need to do is get to the core root of why is it happening. Let's increase function in your body, and let's let your body do what it's supposed to do, how it's supposed to do it, when it's supposed to do it. So when that spine gets stressed or overloaded, it will have to adapt, and the joints of the spine, the vertebra, will go out of their alignment, and it disrupts how the brain's able to communicate down to the nerves and to the organ cells and tissues. If the specific nerves affect blood sugar or blood pressure, or the nerves that go to the muscles around your neck or the back of your head, or even any of the functions of your eyes, that can be what is at the source of causing the headaches. Again, by just taking a pill, you can cover up the symptoms, maybe, right? But you're not addressing what's at the core of the cause. So what we do in our office is specifically at the top of the spine, but really the whole spine. We want to check every single section of the spine, the vertebra, and find out, is that spine being affected by the nerve system because it's out of alignment? If it is, that's disrupting how the brain's able to actually communicate through that nerve system. So what our goal is to restore that function back to 100%, the way that it's designed and the way it's supposed to be. That's the reality of what we're looking for here. And so each individual bone and spine, every vertebra in the spine, we want to make sure that it's moving and that structurally there's no tension there that's disrupting how the brain's able to send the messages down to the spinal cord, out the nerves to all the organ cells and tissues. So I'm going to oversimplify this. I know I'll probably get all kinds of comments in here on TikTok or somewhere along the way. But when I talk about this is oversimplified of how the body works. But I love this. Chiropractors have described this for a very, very long time, but it simplifies to help you understand what we're looking for when somebody comes into our office. And in chiropractic, we call the safety pin cycle. And so as you can see, the brain is up here at the top of the safety pin. Obviously, the brain is what controls, and it sends messages down to the body. So the brain, through the nerve system, makes all the choices, decisions, this innate intelligence, this inborn intelligence. It's how I explain it to my patients here is that your brain, this innate intelligence, every living thing has this inborn intelligence. Innate intelligence, inborn intelligence is like a plant. If you turn it away from light, it's going to want to turn its way back to the light. Why? Because it wants to survive. The body's no different. That you have it at a cell level, but for the whole coordination of the whole body, the brain is really the coordinator of this, and the brain sends messages, mental impulses down through the nerve system, out to all the functions and structures of the body, and it tells it when it's in alignment, it gives it normal function and allows the body to work with ease and do exactly what it's supposed to do. Does that mean you're bulletproof? No. Does that mean you can never get cancer? No. Does that mean that you can't get depression, anxiety? No. Does that mean that you can't have neck pain and back pain? No. What it means is that when that function, the brain's communicating at 100% or as close as it possibly can, it means you have the best chance at normal function. Then in turn, the body takes feedback and it records it and it sends messages back up to the brain, the other side of the safety pin. And it tells the brain, hey, everything's working well here, or I'm running right now, or there's a bear in the room. I need you to increase my blood pressure and my blood sugar, and I need you to get all the energy to the limbs of my body so I can run away from this bear, or whatever it is. And so that whole complete system allows your body's innate to adapt to its environment and coordinate the best it possibly can. Your nerves carry these messages. When the spine or nerve system is out of its normal alignment, it disrupts that communication. So the brain tries to send messages down to the organs, cells, and tissues, and that misalignment creates abnormal or malfunction to the body. And what it does, it says, you can see on this chart here, it says disease. That looks different than disease. I'm not talking about disease as cancers and heart disease and diabetes. Those are medical terminologies. Disease means dis/-ease. That means that your body is not at ease and it's not able to work and not able to do the things you're supposed to do. That's why when I adjust people, they come back. If it's for a different problem, they'll say, man, I didn't even know I wasn't sleeping well, but I got adjusted and I'm sleeping better. Or my focus was better. I was able to relax. My body was different after I got adjusted. I don't even understand it. This is why. Our job with patients that come through our front door is to connect how the brain's communicating to the body and the body's communicating with the brain. When we put yourself in that position, that's what allows your body to go down the pathway of healing that it needs to. Now, the best way for you to know if you have stress and structural issues as far as the nerve system communicating like this, the best way to see it is through a consultation, exam, and x-rays. That's exactly what we do here in this office. So if you're out there and you've been listening to this long and you have these problems or you know somebody that does, send them this video and help them understand, hey, look, there's something different that you can do. Stop taking those drugs, stop taking those pills, or keep taking it. I don't care. But let's find out at the root cause of why is this happening to your body, and let's help you on the pathway to healing along the way. You can see this down at the bottom. Go check out our website. Text us the word consult for a consult, or just say, hey, look, I was watching the webinar and I wanted to know more about how you can help me with my neck and my headaches. And if that's you out there, just make the choice and decision to actually say, I'm tired of chasing symptoms. I'm tired of covering things up. It's time for me to get my life and my body back on track. And see, when you start to get the body functioning at a higher level, it doesn't just help with the neck pain or the headaches or the back pain or whatever else it is. What it does is it's telling your body that it needs to function at a higher level. And it's allowing your body to function at a higher level is a better terminology of saying that. The reality is that if you don't address that, more things are just going to keep popping up down the pathway. I was telling a good friend of mine last night, he's got this major back pain going on. I said, listen, I'm not worried about the nerve problems that are causing the back pain right now. What I'm worried about is that's the same nerve system that actually goes to, you can see down here at the lower part of the back, it goes to your digestive system, it goes to your male reproductive organs, it goes to your kidneys, it goes to the nerves to your legs. If you keep these problems there and do nothing about it, it's only going to keep showing up as bigger issues down the road. So the reality is if you have symptoms, number one, you can do nothing about it. Number two, you can medicate it and cover it up. Or number three, you can find out what the cause is. A great way to do this, see a good chiropractor in your area. If you're not here in Charlotte, I'll help you plug in and find somebody if you need to. Just text me and I'll help you with that. But if you're here in Charlotte, come see us, see what we can do to help you out, see how we can help you get on the pathway to healing. Love you guys. Appreciate you. Have a blessed day.